Good afternoon. This is Andrew Mellin from SureScripts. We will be starting this presentation in just a few minutes. Good afternoon. This is Andrew Mellin from SureScripts. We'll be starting in about a minute. Good afternoon. This is Andrew Mellin with SureScripts, and welcome to our session. That was awkward, the prescription cost conversation. And we'd love to be doing this in person at HIMSS, but short of that, I'm excited to be here with Dr. Forbes from Pediatric Associates to have this conversation. And before we jump in, I just hope all of us took a moment to reflect on those statistics on that first screen and thought about what this means to you, what this means in terms of conversations you've had with your providers, conversations that your provider had or didn't have with you, and how that affects your care and the perception of your conversation, of your relationship with your physician, and most importantly, what this means for you to be able to take those medications that you and your doctor have talked about. We'll touch on some of those subjects today in our lightning session with Dr. Forbes. So Rebecca, please advance a slide or two. So I'd like Dr. Forbes to please introduce yourself.
Sure. Thank you so much, Dr. Mellin, for that introduction, and I'm very excited to be here today. I'm Dr. Michelle Forbes. I'm a partner in a physician-owned pediatric practice in suburban North Texas, and I'm responsible for identifying and implementing best practices in our organization.
Great, and thanks for joining us today. I'm excited to hear your great stories. I'm Andrew Mellin. I'm the Chief Medical Information Officer at SureScripts. By background, I'm a physician in internal medicine, worked part-time as a hospitalist for about 15 years, but full-time for about 20 years in health information technology. So, Dr. Forbes, just tell me about an awkward cost conversation that you've had with your patients and that patient's parents.
Sure. I saw a patient for follow-up for ADHD, and the parent and teacher reports were dismal. The patient was not improving, not doing well. And so I began to steer the conversation towards adjusting the dose, increasing the dose. And, quite embarrassedly, the parent interrupted me and said, "We never started the medicine because we couldn't afford it." And that opened the door to us starting to talk about medication costs and exploring that with patients.
Yeah, and I think conversations like that are happening in every exam room across the country today, with the cost of medications increasing, with some of the complexities about knowing which drug may be the least expensive. It's just so important to know the actual cost that the patient's going to pay at the pharmacy. So, Dr. Forbes, why is this cost conversation so important in your practice now?
Well, it's so important because of adherence. Patients improve when they can follow the treatment plan. And if part of the plan is not realistic in terms of cost, then I feel like we've lost them before they walk out of the exam room. If you consider chronic illnesses that will require medication for months to years, price eventually becomes an issue. So why not address it head on?
Yeah, that's great. And study after study has shown that cost is usually the most important factor for medication non-adherence and not picking up that, first dose of a medication. So having that cost conversation is so important. And really, it's something that's being talked about at all levels of medical practice today. So you've done a great job, Dr. Forbes, and how you've made this not something that the patient always brings up, but something that's just part of every conversation that you're having. And tell us a little bit about how you're doing that in your practice.
You're right. I do make it part of the visit. What typically happens is after I've decided on a plan of care, I will bring up the conversation by saying something like, "I have a medication in mind that I'd like to prescribe, but before we get there, I'd like you to look at a tool that I have available that tells me your specific out-of-pocket costs. And if the medication that I have in mind doesn't work for your family, then we can also look up alternatives that will work just as well and examine and explore what those costs might be for you."
And how your patients react when you bring that up. As I think some physicians are worried that patients don't want to talk about costs. Other physicians are uncomfortable bringing it up. But how are they reacting to you?
My patients seem relieved, but I'll have to tell you that I bring it up in a way that makes us feel like we're allies. So I'm not making assumptions about their budget, but I'm saying it would be nice if we could look at what medications will cost for you before I prescribe them. So the approach is really important. You've got to make them feel like this is a team, a joint effort. This is shared decision making in the exam room. And the beautiful thing about the tool that I have access to is that it's accurate for their specific plan and it happens at point of care.
Yeah, excellent. And have you noticed any differences in having these conversations? What did the patients what have they said to you, um, or are you getting less phone calls? What are you noticing?
Yes, patients are very, very happy because we're bringing it up, and most of them say, "I've never had a doctor bring up the cost about the conversation about cost with me." The other thing that's really nice is my staff is happy. We have fewer phone calls from pharmacies about what's covered, what isn't covered. We have fewer prior authorizations to take care of because we know before the family leaves the exam room what the cost will be. And I have fewer phone calls from my parents wondering if we can try different options to find something that fits to their budget. Everyone is pleased and relieved when I have this conversation in the exam room.
Yeah, I think it's a win for everybody. Patient knows they can afford the medication. You're not getting callbacks here. You're having I think, it's a great way to sort of strengthen the relationship you're
Yes.
having with the patient in a shared decision-making way. And, as we think about topics like burnout, where it's rework and redoing things that you thought you were done with, this isn't the panacea that's going to eliminate burnout, but it eliminates a lot of those nuisance phone calls because you're getting things done right at the first time. I think that's great.
You're very correct. It does mitigate some of the burnout from nuisance phone calls.
Yeah, and as you think broadly, and I think broadly about this topic, this is something that's on the mind of really so many patients. And we just did a survey of about 1,000 individuals, 1,000 consumers, talking about cost and talking about medication costs and conversations. And, certainly I've seen a lot of academic data that talks about the importance of costs, but this survey was really remarkable with what I think with this first statistic. 53% of patients reported they have not taken a medication because it was too expensive. As a physician, that's remarkable and scary. That patient has come into the exam room with me. We're having a conversation. We agree on a plan. And yet 1 in 2 patients said, I couldn't follow through with that plan because the medication was too expensive. So, and I think these other statistics, are support this concept of having that information. Certainly most patients, virtually all patients, would take a lower cost medication if one had been suggested to them. And I think some of the other data that came out of this was that this wasn't just about that individual interaction, but what we saw is patients, many patients said that this strengthened their relationship. And in fact, um, this conversation that Dr. Forbes described becomes something that increases their satisfaction with the doctor, increases their stickiness and staying with them, and even helps, bring about referrals back to that physician. So it's a conversation that goes beyond just that individual discussion in the exam room, but really has great ramifications beyond that. Dr. Forbes, as we have an audience of mix of people who work at health systems, practices, some other
Mhm.
clinicians. Um, if you were going to tell them, here's the one thing to do today, to do at the end of this conversation, this lightning session, what would you say to them?
I'd say be empowered to bring the shared decision making back into the exam room where it belongs. For clinicians like myself, we were taught how to diagnose and formulate a plan of care. And for many years, centuries, that decision making happened in the exam room. And this is a tool that I have found that brings the autonomy back. It empowers my patients, it empowers me to make the decision in the exam room. And you spoke about patient stickiness after these conversations. I have found my patients are grateful that I am just as interested in their financial health as well as their physical and mental health.
Yeah, and I think all of us are, virtually anyone wants to save money, but I think what you see and you look at this data is sometimes that dollars, those choices that they're making are not just, hey, I'm going to save $5 or $10 and that's nice,
Mhm.
but these are choices between what they're giving up to pay for the medications. So this cost is more than just saving some dollars, but for many patients, it's not having to give up a meal or not having to give up something for their child,
Correct.
some school activity, whatever it is. These dollars really count. And I think anything you could do to help patients get the outcomes that you want them to achieve, but the lowest cost at the highest value is a win for everybody.
I agree.
So, building on what you said, Rebecca, to the next slide, we do have some things that we've worked on that are available to the audience members that help you learn about how to have these cost conversations. I think one of the things Dr. Forbes talked about was embedding this in your conversation every single time and having this conversation in a way that's not threatening, not assuming, you're not judging, but it's just part of the conversation every single time. And what you will uncover is the people that maybe you think wouldn't have any economic problems or economic challenges often do. Um, you will uncover that there are times when you weren't expecting someone to say they were not compliant because of cost, find out that they are. So these are conversations that are really critical to have. And again, we've put together some starter things that we encourage everyone to make their own. We will be sharing this at the end of this webinar in a couple days. We'll send you a link to these conversation starter and document. Now we do have some time for a few questions at the end. So for any audience members, if you have some questions for myself or Dr. Forbes, please go ahead and type it in. Use the GoToMeeting question section and just type it in and we'll look through that. And while we're waiting, Dr. Forbes, let me ask you a question to start. You talk about how you're having these conversations in the exam room.
Mhm.
Do you show the patients or their parents your computer, your EHR, as you're having those conversations? Or how do you do that? What's that interaction look like?
I do. I actually show the tool. It's embedded in my EMR. And I think it takes the mystery out of drugs and their costs when I say, this is what I'd like to prescribe. Let's look at the dose. Let's look at the instructions and let's look at the quantity that I want to have the pharmacy dispense. And it shows me the actual cost for that patient. And so we'll look and sometimes we'll make a bookmark. Okay, this might be reasonable for the budget. And then sometimes the parents will say, I don't know, that's a bit more than what we'd like to spend. And so I'll pull up an alternative, dial in the instructions and the quantity, and you get a price right there within seconds, and it's accurate. So I type it in, but I show them, on my screen, the actual price as it comes up in the tool so that they can decide.
I think that's the perfect way to do it, bringing the patient, the family into the conversation, letting them see what you're seeing, and then again, having a shared decision-making process with them. I think one of the other, some of the other data points we see around this is it's not just changing to a different drug, but sometimes they can save a significant amount of money, especially on chronic medications by going from a 30-day supply to a 90-day supply, or maybe moving to a mail order benefit. Those are things that, as a physician, I often
Mhm.
wasn't aware of, but I
Right.
think this brings it to light.
It does. You bring up a great point that it does give options for, the quantity 30-day or 90-day supply. And it also shows the local pharmacy. So my parents can decide, I've got a pharmacy I usually go to, but the tool shows me that I could get the medication that I want and that I've been using at a discounted price at a different pharmacy. So not only do you get the price transparency, but also from pharmacy to pharmacy, what might work best for them.
Yes. And then one last question I want to ask you about is around prior authorization. That's something you mentioned that's decreased. Now, my understanding is that's because when you pull it up, in addition to seeing your original medication and potentially a prior auth flag associated with that, um, you will see medications that may not need a prior authorization. And how have you found that helpful in your discussions?
Well, it lets us decide in the exam room, and I'll tell a family, here's an option that's available without needing additional authorization from your insurance company. And you could probably start it today. Whereas if something requires a prior authorization, I tell them there's a good chance it could be a week before we can get this cleared. So let's decide today. Would you like to start your treatment plan today, or do we want to wait for authorization? And oftentimes parents will say, I'd rather go with the option that we can start today.
Yeah, and I think that's great. And I think not only is it time saving for the patient, but for you as a physician, avoiding a prior auth. The best prior auth is the
Yeah,
one you never have to do. So,
exactly.
so that's a
Yes.
big win for you. Well, I don't see any other questions at this point. I will say, um, for me as a physician and someone who's been in health IT for a long time, this has been one of the most exciting tools that I have ever been associated with. And to your point that everyone wins from this is something that you rarely see in health IT. So it's great, and it's available now for over 250,000 prescribers across the country and their EHRs. So it's exciting times, and I'm thrilled to have this information available for physicians and providers as they make these decisions. And I want to sincerely thank you, Dr. Forbes, for sharing your stories and your insights, the way you approach things, how you've embedded this in your conversations at every single patient. I think there's a lot of lessons there that all of us can learn from. And again, a sincere thank you for taking your time to share your thoughts with us today.
Absolutely. You're very welcome. It was my pleasure.
Thank you. And then again, we will be sending out the recording of this, a link to the recording in a few days, as well as some links to the documents that you see on the screen. In addition, if you have any other questions related to this tool, in the follow-up email, we will have a link of a place where you can email additional questions that we can answer for you. Again, thank you, Dr. Forbes, and thank you everyone for your time today.
You're welcome.